Morning. All right, welcome everyone to this month's ARPA 1.05 Provider Grant Training Informational Session. We appreciate you being here. We're going to go through a handful of slides and then we'll have time for some questions after the fact. So let me just go through some simple housekeeping real fast. You probably heard we are recording. So that is twofold actually, for us to be able to capture notes and then also for us to be able to put this on the website for future viewing. So if you have folks that aren't able to join today but would still like to view the information, you can provide them with the website, which we'll share in the chat here in a second, where that will be posted. You are welcome to use the chat to answer or ask questions. We'll be answering in the chat throughout, but you can also raise your hand as well to ask questions throughout. All the meeting material will be posted to the ARPA grant website, which I can provide you here in just a second in the chat. That's where you can find past meeting these informational session recordings as well. FAQs that are updated regularly, information about the grant itself and all the application materials can be found on that website as well. So we'll be sure to share that throughout. If you're listening by phone, press *6 to unmute your line and *9 to raise your hand. And we'd be happy to get your question answered. I have turned on closed captioning. So if you haven't seen that yet, on your toolbar at the bottom, you should be able to turn on captioning. And then more information about our team specifically can be found at the Direct Care Workforce Collaborative website, which again will be shared in the chat shortly. All right. Heather, I can give folks a few more minutes or we can jump in, whichever you prefer.
We can jump in. I think that is fine.
All right, here you go.
Thank you all. My name is Heather Johnson. I am the ARPA Long-Term Direct Care Workforce Unit Supervisor. It's a really long title. To say that I work with a pretty awesome team. There's 6 of us total, all working on direct care workforce issues across the state. And most of our work is funded through ARPA projects. So it's various different ARPA projects. And if you don't know what they are, I would invite you to come to the Direct Care Workforce Collaborative because we talk about them a lot there, or also just check out our website. So today we try to do these every month so that folks kind of have an idea of the grant's purpose, we'll do a little bit of an overview and then have time for questions, as Brooke said. The training grant purpose is to provide training opportunities for direct care workers to gain higher level skills. Our idea with that is if we can provide additional training that might help them do their job, take on additional members to work with, they could maybe leverage that in their career for different employment opportunities. We'll discuss a little bit more specific about this, but when we say support specialization and advancement opportunities, we have to be really careful that it is specialization and not general onboarding training, because we are not allowed with this grant to supplant things that are already supposed to be happening. So when you think of this grant, the purpose is giving training opportunities to direct care workers to help them elevate their skill level. Next slide, please. So when I think what we really seem to struggle with in maybe communicating to folks, when we say direct care workers, who are the direct care workers? Because there definitely is a difference between I work directly with an individual versus I provide direct care work with the terms of this grant. So we added this slide. When we think of direct care workers, this isn't all inclusive, but it might give you a good idea. These personal care, homemaker, all the stuff listed here are actual carve-outs in the HCBS waiver. These are billable services typically performed by a direct care worker. We are going to work on some of our resources in the grant application materials to kind of maybe further define direct care workers, because we also have another grant coming out that's also for direct care workers on an individual basis. We want folks to have a clear idea. So we're looking at a direct care worker as someone who spends at least 50% of their time or more providing hands-on personal care support to individuals in the HCBS waivers. So that personal support is preparing meals, helping them eat, helping them with housework or doing the housework for them, helping them plan their day-to-day activities, helping them with their hygiene, their dressing, doing transfers, doing lifts, toileting, shopping, money management, behavior plan implementation. Some of that is that moment-to-moment safety that some individuals need. That is what we're looking at in direct care workers. So the training for this grant has to be for those folks who are doing those activities. There is a little bit of a carve out in there for certified nurse aides, CNAs, and long-term and home health aides who are working in long-term home health with our HCBS waiver members. All right, next slide. The other thing I really want to try to be clear about is helping folks understand what kind of training. So we put a little yes, no, and maybe because these lists aren't all inclusive. So in the yes column, you'll see some trainings in there. These were grants that have been, grant ideas that have been awarded. One agency developed a mentorship program for their direct care workers where they provide that person training to then provide that mentor training to new hires and kind of follow them through in hopes to help make sure that they really stay in the field and stay with that employer. Crucial Conversations was another one. I'm really trying to help people understand communication at a different level and how to maybe be more proactive with communicating with your members, with your coworkers, with your colleagues, with your supervisors. Trauma-informed care is another one. Motivational interviewing. Some frequent requests we get on grant applications is some of that general onboarding or annual requirements, CPR, first aid, QMAPs, safety care. There's quite a variety of behavior management trainings out there, abuse prevention. If it is something that your agency requires for a person to be hired or maintain their employment, that would not be eligible for this grant. And so I think that's something that folks can look at is like pull out your procedures, your policy handbook, what are your onboarding and annual trainings, and make sure that you're not requesting the grant for those. The maybes, if you have, I'm thinking of maybe like a specific dementia care, right? We're working with maybe a population who's getting older. How do we help folks with dementia and their families like navigate that? Grief and loss is a big one. How do we help direct care workers understand and process grief as they're working with individuals and as they age or as they pass away? A little more positive here. Well, I don't know. I would say think about your maybes and we'll bring that into Q&A. I'd love to be able to answer them there. All right, next slide. Eligible applicants, there is a narrowed application process there. You have to be a HCBS provider. And we do a little verification of that on our end. And if there's any question and we don't see it on our end, we may ask applicants for additional information. Or you can be a training vendor or a training provider that develops training programs that will be delivered to the HCBS workforce. All right, next slide. Eligible expenses, the grant is up to $100,000. It doesn't mean that you have to ask for $100,000. You can ask for $6,000. We're really going to consider everything up to the $100,000. I will say if you ask for over $100,000, we will not be able to review your grant application because I wouldn't know how to advise the grant review committee to pick what could be approved or not if you ask for more than $100,000. When you're talking about the expenses, what you're wanting that to cover, it's got to be the training and the training materials. So provide some details on how you figured that cost. We are going to hire a trainer to develop this training and deliver it, what that cost would be. What is it, what would you pay the trainer per hour? How many hours a week would they work? Like we're looking for that level of detail. If it's for training materials, how are you getting that cost? Vendor quotes, you can always include those or reference those. We really want to see how you understood. We want to understand how you came up with that information. And I was looking for, it's not on here, the slides, but I would really ask folks to look at the FAQ because it does list what eligible expenses are or not. There's some pretty narrow parameters of what we can fund. We can fund the cost of a staff to take the training. If you're bringing a trainer in to provide this training to your staff, their wages can be included in that. We would just need to kind of see what that breakout looks like. We cannot pay for the trainer to come. We cannot pay mileage. We cannot pay housing or, lodging for that person to come and do the training. Individual subscriptions would be an option of what would not be covered. So there's quite a big list there. So just kind of look at that and keep in mind, it could be that those things are needed for your training to work. You would just explain how you would cover those with another funding source that's not this grant. One of the big ones we see is basically cost to advertise this, and we cannot cover that. We understand communicating your training is super important, but we would want to see how you're going to get that word out. And we will provide some resources for some of the training vendors or training that's going to be open statewide. We do have a communication outreach resource where we can kind of give folks a way to identify routine information that goes out so that information can be spread throughout the state. All right, next slide. The guidelines, some folks have asked, you can apply for more than one grant. You just have to complete one grant before you apply for another one. So some folks have been doing a short-term like pilot program to see how it would work. And so maybe they wrap up by June. As long as they've closed their stuff out by June, they can apply for in the next grant cycle. Anything that you are looking for, it has to start after you've been awarded the grant. So if you can't do stuff now and want to be reimbursed for it after the next grant cycle starts, we look for what that plan looks like when that stuff will be starting, so that we can make sure that it is approved and then done, not done and then approved. All right, next slide. This is our grant award cycles. We will stick to this unless we run out of money ahead of time. So we have completed 2 grant cycles so far. We have 4 more to go. February through March is the grant cycle. So we typically keep them open 2 months, and then folks know usually by the 14th, 15th day following that grant cycle close whether they've been approved or not. And then they go from there, next steps on how to get everything going. So keep in mind, if you're thinking about maybe ramping up, like doing a pilot program and then doing something bigger, you would want to keep an eye of this grant cycle to see how that would work. If you want to apply for several different training grants, just keep these dates in mind. All of the expenses have to be completed before 12/31/2023. That is a requirement for the ARPA funds. Next slide. And this is the easy/hard part, completing the application. It is on Smartsheet. We feel like it's pretty reasonable to complete. If you do have questions, you can email us. You'll find the project budget is in Excel. You would just want to download a copy of that and complete that and attach it to your Smartsheet, along with a W-9, certificate of good standing, and a cover letter signed by your executive director. If you are a for-profit, you are likely not going to have that certificate of good standing, and we will address that. We cannot look at your application unless all of this stuff is complete. So when we review applications as they're submitted, we check for all these things, and then we reach out to folks and say, hey, we need something else. If you are having a hard time figuring out how to attach these to Smartsheet, you can email us those to our workforce email. That would be perfectly fine. All right, next slide, I believe, is questions. All right. Now I'll leave myself open.
Yes, we already have one from Kelly. Actually, Kelly is asking that they were denied for the 1.05 training grant, yet their application met both of the training grant purposes, serving over 250 members on HCBS waivers and 500 unique Medicaid members. They're truly baffled and we're wondering if you could give some clarification.
Sure. Kelly, is the training for direct care workers who are doing the personal care, the respite?
Yes, well, specifically our clinicians are massage therapists, music therapists, and behavioral therapists.
So none of those would be considered a direct care worker.
So Heather, that was not, like, it just said HCBS Providers on the application when we completed it. And I do have to say, I'd be very disheartened if just this handful of provider types was left out, because the same thing happened during the pandemic targeted rate increases. Our therapists struggled just as much. We were furloughed. We weren't able to do hands-on work. We brought everyone back. We retained those jobs, and those rates are still unsustainably low. So we are in just as much need as all of those types of direct care workers. And we were left out of that. And the Joint Budget Committee of the state legislators recognized that we we're unfairly left out of that, and HCPF has acknowledged that before. And so I really ask that not happen again with this training grant.
Well, unfortunately, the parameters for this have already been set. They were established before it all started. So there's no, within this grant, that is, we really, it is geared toward the direct care workers who are providing that workforce, the hands-on care. So for this application, I'm not aware of, I'm sure you've probably looked at the other grants on HCPF, but
Heather, we do provide hands-on care. We do provide hands-on care. And then the other part is we were denied. So we've often gone to developmental pathways for a grant to support training that our team is looking for specialized skills that we can't provide out of our budget because of those reimbursement rates being too low. And developmental pathways denied the grant because they said this is what the ARPA 1.0 training grant is funding, and we're not funding training this year because you can get that funding through the ARPA training grant. And so we were actually directed by developmental pathways to this grant for that exact reason.
Okay. Well, I'd be happy if you want to send that, that email from developmental pathways to loop them back in and let them know. I'd be happy to support that. And we're not saying that the work that your folks do isn't important. We're just saying it's not a fit for this grant, and we are heavily audited, and we have to make sure that we follow the parameters of this grant. So I do thank you for your question, and feel free to, if you would like to loop me in even with developmental pathways in an email, I'd be happy to confirm with them why the specifics of this, and then hopefully that might help you back on their end.
Yeah, well, I guess I'm wondering, like, it's all of these services, but it's not specifically, it's not as just a small subset of services that are part of the direct care workforce. And so I'm still not understanding why we're being excluded.
So, and I mean, all I can really offer is it's people who provide those personal care. So if it is that direct care person who is preparing the meals, helping the person eat, helping them bathe, like that is that direct care workforce that these funds are targeted for. And so, I mean, it's not to say that there's a value difference between them and another work field. It's just that's where these funds are. And that's where we're at. So I don't feel like we're going to have a solution in this webinar. And the one thing I can offer you is, feel free to loop me in an email, and I'd be happy to provide some information that you could take back to the developmental pathways that might help them reconsider funding that they have.
Okay, can you provide your email address, maybe via direct message?
Sure.
From here? Thanks.
Can do that. Yeah.
Perfect, thank you. I don't see any other questions coming in, but we'd like to open it up at this point for other questions. You can certainly use the chat function, or you can raise your hand, and we'll just give you this time to ask questions about this grant and the application process, or whatever's on your mind.
And we won't pressure folks to ask questions if you don't have any now. If they come up later, please. Oh, we got right here. For profit. Okay. So Erin is asking, if it isn't later in the slideshow, can you address the for profit and letter of good standing? You'll have to apologize. I'm dog sitting and they're anxious. You can be, so nonprofits have a certificate of that good standing that they could provide. If you're not a nonprofit, then that isn't needed. If your question is specifically how to obtain that, we could provide you some information with that if you just drop your email in the chat.
Thank you, Heather. All right, Rose is asking, we are licensed for both HCBS and ICF. How do we delineate? For example, can we only ask for locations with HCBS licenses?
Yes, that would be the cleanest way to do that. Is you would demonstrate that the training is for this HCBS population, your HCBS workforce. What we would not do is ask you to prove that they only work in HCBS, because we do know that sometimes folks might have several jobs and maybe work in the HCBS world and the ICF world. That is not we are not going to go down to that world. If they are your HCBS direct care staff, then you would just, because you have to list your Medicaid ID number in there, you would just list it for those sites.
And she says that one property has both ICF and HCBS.
I think if you could provide some information in the application about how you would make sure that that is directed to the HCBS population. And if you want to attach a letter that describes that, that would be fine. If you don't find a place for that in the application or room for that, you can provide a letter for that. The grant is reimbursement based. So when you are submitting that information for reimbursement, that's where that verification really comes through, where you would be able to say, you know, we said we had 58 HCBS direct care staff, we provided, and then let's say you bill for 73, then we're like, but you said you had 50. Where'd these other come from? And, you know, so it kind of gets, it'll get figured out that way. That's our checks and balance system there as well.
Perfect. It says, Chanel, let me apologize if that's not correct, but they're saying we were denied. We had the following trainings: movement, feelings, fitness, transition support, benefits of assistive tech. We provide respite, mentor, and community connector. I'm not sure if you want to come off mute maybe and ask if you just want some feedback on that, or we can provide something like that. I'm just not sure. Yeah, thank you.
Yeah, we're also shocked that we were denied as well. We provide all the information that you have mentioned. And, you know, and we do have direct care workers, mentor, community connector, respite, and a few other ones. So we're just not understanding, you know, why we were denied when we have all these beneficial trainings for direct care workers.
And you know, without knowing the specific application, it's hard to give a lot of feedback there. It could be that maybe things were not as clear as the grant review committee looked at stuff to understand that this is training that the company is providing to their direct care workers. So if you would like to, you could even just in private message, if you would like to, you can send me your the name of your agency.
Okay.
And I could probably be able to take a quick look and kind of give you some feedback. We'd always welcome folks to reapply. Sometimes things just don't maybe come across as being real clear in the application process, and it doesn't mean that it wouldn't work. It just there might be some tweaks that you can do on your end to make sure that it's a little bit clearer for the committee.
Okay. Now, is your email listed in the chat box?
It is not. Oh, you can see where it says to everyone. If you just drop that down,
okay,
and click Heather, I think I'm in there. Yeah.
Okay. Great. Thank you.
All right, Kelly, I see your hand raised, and then Vanessa, I'll get to your question in chat. So Kelly, please.
Yeah, so I pulled up the materials we used to apply, and it's actually the same page, and under both the summary eligibility, and then when you click on the more detail for grant eligibility, it says who is eligible: currently enrolled home and community-based services waiver providers. And that's the same thing it says when you click on the grant eligibility detail. And so it's like, to me, there was no warning that we would not be eligible for this, because we clearly are that. And I mean, it just feels like really hurtfully exclusive, like, or very targetedly, like we're being targeted exclusion. And we dealt with the same thing during the pandemic, and HCPF later came back and said that we shouldn't have been left out of the targeted rate increases that went to all of those same services that you've called out for this grant as well.
Kelly, I think we're going to have to agree to disagree on this, and I want to give other people a chance to ask some questions. I understand where you're coming from. I'm just telling you that we have to follow the parameters here. Look at the request for application. If you would like to provide some feedback, even via email, about maybe how things could be made clearer so this doesn't happen to other people, would be happy to take that into consideration.
Okay.
All right, so we have a couple more questions in the chat. Vanessa is asking, we are waiting to hear if we're approved for the 6.06 grant. Can we still apply for 1.05 while that one is pending?
So yeah, as per my understanding of 606, it is all EHR. And so that would not be related to this grant. If you have any sort of concerns about something overlapping, we would want you to spell that out, in the application. You say, we're applying for the 606 grant, this is for any training we would provide for that staff or related to the EHR access, would be addressed under the 606. So I would just ask that you just spell it out in the application or put it in your letter or, a supplemental documentation.
All right, and we just had one come in. If we are training the DSP managers to write and train on better B/ISSP goals to increase our person-centered training and goal tracking, would that be too removed? Hoping the training will support the providers in caring for and meeting the individual's requested goals without reducing their focus and direct care time available to the individuals they work with.
So on the surface level, just reading it, if it's training to managers, so are managers supposed to know how to write those goals? And you ask yourself that, are they supposed to do this? If that is their job, then this would be supplanting that and it would not be allowed. If I hope that provides a frame of way to look at it. Are we required to do this? I've seen some come in as like administrator license, or we want to be able to pass surveys. That is already the expectation, not saying that additional trainer doesn't have that. I know I'm not saying that. I'm just saying the goal, this grant couldn't be used for that because that would be considered supplanting. So looking at that, what you could do, if you found some training for your managers to help to write those goals and then bring the training in to help, figure out how to tie that into how the direct care workers would be able to do something additional than what they're already trained to do to help support those goals, you might have to look at it at a bigger angle.
Perfect. And just as a reminder, if we're answering your questions in the chat and we're missing the mark, you're welcome to clarify or ask clarifying questions in the chat, or go ahead and come off mute too if we just need redirected. So. And that, I see that is it for now, Heather. We'll just give folks maybe a few more minutes in chat.
Okay. And a good way to ask questions is using our the workforce email. We most often do not respond to questions individually, just because that becomes very cumbersome to be able to do that. We take those questions and we put them on our FAQ and answer them so that everyone can see, and it sometimes helps get that information out to everyone else. So please feel free to send questions in to the HCPUF workforce email, and we do alert you when we update the FAQ. We try to keep it to a 2 or 3 day turnaround, no more than a week, and making sure we get those answers back to you, because that helps inform the application process.
All right, I'll just do a last call.
Last call for questions. While you're thinking of those, if you know of folks who providers out there who are not aware of this, please reach out to them and invite them to consider it. If you know of other providers who've been successful in obtaining a grant, feel free to use those community connections you have with them to maybe get some ideas. Ask them to kind of talk to you about the process a little bit. That might help. At our next Direct Care Workforce Collaborative meeting, we are inviting the successful grant applications to come and give some information to folks about, where they got their ideas from, a little bit about the process. We would like to build a community of practice, within our HCBS provider community about this. So, word of mouth is sometimes the best source of advertising. So we just put it out there to please share this with others, invite people to the web. This will be on the message. So, this will be on the website. So you can always just refer to them to come and look at that.
Yeah, one more comment. And I say this mostly for Heather and Brooke, but I want to raise awareness that we are the largest movement therapy provider on the HCBS waivers. The second largest had to close on January 31st due to staff attrition. And our own massage therapy team has shrunken down to just a couple of part-time folks. We've lost the 5 full-time folks we've had for the same reason, for the pay. And I just want you all to know that we are part of the HCBS community. I wish we were seen as a valued part of that community, but we certainly are having workforce retention issues, and we could use the support as well.
I appreciate that. Thank you, Kelly.
All right, I think I will go ahead and end the recording. Thank you all for attending today. As questions pop up, let us know, and we look forward to seeing you next time.